Hi everyone, my name is Carolyn Peterson, and today I'm going to be talking about the therapeutic use of animals. The definition of the therapeutic use of animals is that it involves a variety of terms and phrases to refer to the guided interactions between animals and humans to achieve therapeutic goals. The strength of using animals in therapy resides in the feelings that are often elicited by using animals in therapeutic contexts, the diversity of settings and populations where animals can be used therapeutically, and the wide range of potential benefits. The effects of therapeutic use of animals have been shown to attribute to a sense of normalcy and well-being and have had an influence in the social development of individuals. The different phrases that describe the concept of therapeutic use of animals are animal-assisted therapy, animal-assisted activities, resident animals, companion animals, and service animals. Animal-assisted therapy improves patient's mental, physical, social, and emotional functioning with the aid of animals. When using animal-assisted therapy, the therapeutic recreation specialist develops an individual's goals for each participant and documents progress towards those goals. Animal-assisted activities are activities that include interaction with an animal that provide opportunities to increase motivation, learning, and leisure, resulting in therapeutic outcomes that enhance a person's quality of life. Resident animals typically live in a human service facility full-time and are used to boost the morale of those in residence. Household pets such as dogs, cats, and birds are considered companion animals. And service animals help increase independence and quality of life of individuals with disabilities. The belief that animals have positively influenced people has a long history, and the strength of the animal-human bond has been recognized for thousands of years. Animals have provided humans with the means of protection, transportation, power, and companionship. The first documented use of animals in a therapeutic setting was in Geel, Belgium, in the 9th century, and there's evidence of therapeutic use of animals in the late 1700s in England at the York Retreat, an institution founded by the Society of Friends. William Tuke, who was an English merchant and philanthropist, encouraged people receiving psychiatric services to care for animals to increase their self-control and involve them with a being that would unconditionally provide affection. Stories and medical history documents that people receiving services for psychological disorders were encouraged to spend time with farm animals. An important facet of the treatment involving these farm animals was that the animals became dependent on the people. Animal-assisted therapy services are provided by a variety of organizations, some for profit and others volunteer. But the best known and the largest volunteer organization happens to be Pet Partners, a non-profit international organization whose mission is to educate and promote the benefits stemming from human-animal interactions. The use of animals to assist people in achieving therapeutic goals has occurred in a variety of settings, such as nursing homes, therapeutic farms, and residential psychiatric treatment facilities, and with a diverse range of populations, such as individuals with depression, autism, social limitations, PTSD, cerebral palsy, intellectual disabilities, and even dementia. Animals have been used to assist with development of empathy and positive social behaviors. The benefits for animal therapy are improved fine motor skills, balance, social skills, increased focus and attention, self-esteem, and the ability to care for oneself. It reduces anxiety, grief and isolation, blood pressure, depression, and risk of heart attack or stroke, greater self-control, and enhanced problem-solving skills. Two explanations have been presented to identify orientations that contribute to understanding how the therapeutic use of animals might work. The human-animal bond is the basis for people's desires to be with animals. Our natural environment includes animals. Domestic animals influence the physical and mental health of people through the human acts of touching, caring for, and being close. It is the bond between the pet and its owner that can be therapeutic. Therefore, to use animals in therapy is a natural extension of that bond. Most people writing about the therapeutic use of animals show a psychoanalytical orientation in discussing how pets influence people. Psychoanalysis is based on the premise that unconscious processes or conflicts are at the root of abnormal behavior patterns, meaning that unconsciously humans may be drawn to animals and interactions with them. Many treatments for PTSD involve prolonged exposure that call for individuals with PTSD related to a certain event to recall repeatedly that event. Often prior to prolonged exposure, reducing effects of PTSD causes fear, increased anxiety, and treatment abandonment due to the stress of recalling the event and/or situation. The theoretical model developed by Lefkowitz and colleagues involves including animal-assisted therapy to increase individuals' abilities to tolerate prolonged exposure. The model includes at least 5 sessions with both therapist and dog in sessions. Prior to the initial session, the participant is assessed to determine the person's willingness to work with a dog during prolonged exposure sessions because the person could have allergies or fear of dogs. If the individual agrees to work with the therapy dog, then treatment begins and the therapist introduces the participant to the dog so that they can become familiar with one another. If the participant exhibits anxiety, the person is encouraged to play with the dog as well as practice relaxing breathing techniques, especially as the session progresses and further delves into recalling details of the assault. For children with autism, studies have found that when animals such as dogs, cats, and even guinea pigs are present, they experience less anxiety. For adults who have autism, animals can also provide similar benefits and can often help calm someone in moments of anxiety. Petting, hugging, or having a dog put pressure on the person by using their paw or lying on them creates a calming effect. Animals can help improve your self-esteem, develop social skills, and reduce symptoms of anxiety. So for those dealing with social anxiety disorder, animals such as horses, dogs can pick up cues in social relationships. A therapist can use these reactions to guide therapy sessions. Animals in therapy provide the opportunity to give affection and to receive it. This may be particularly helpful for children and teenagers who are struggling to find connections among family or peers. For those who are suffering from PTSD, psychiatric service dogs are one alternative treatment for those who do suffer from PTSD. These dogs are specially trained in obedience, performing tasks, and working in public environments to help their partner manage their PTSD more successfully. They perform tasks and enable their partner to be more productive. Psychiatric service dogs also make individuals with PTSD feel safe in their own homes. Sometimes, unfortunately, people with PTSD are unable to enter their own homes because they believe that there's someone in there, like an intruder or another threat inside. The dog will then perform a systematic search of the home or the room and bark if it finds someone. Animals aren't limited to helping us in only physical ways. In this activity, you can see that when he comes home, Mia greets him with a warm and loving welcome. Mia is a service dog that helps with his anxiety. You will see how animals, specifically therapy dogs or service dogs, can improve our mental well-being by reducing tension and improving mood, as well as being loving companions. People definitely trust dogs. They let their guard down and confide in them. Petting and talking to Mia helps release tension and stress from his day. Dogs provide love and friendship. Her kisses are what helps reduce depression and encourage more positive interactions with other people. Having a pet can diminish feelings of loneliness or isolation. Spending time with pets can relieve stress and anxiety and boost happiness. People with anxiety-related issues can gain a tremendous benefit from having a specially trained service dog. Service dogs are companion animals that help people who have a physical or mental condition. A service dog for anxiety can provide a sense of calm, anticipate anxiety attacks, and even fetch medication for their owner. Therapy dogs provide numerous benefits for those with anxiety disorders and autism. Those who are anxious and feel disconnected from their peers need the unconditional love of a therapy dog. The ability to trust and confide in their dogs often leads anxious individuals to be more open and help their ability to make friends. The many benefits of anxiety service dogs include detecting signs of an anxiety attack before it happens, or calming a person down during an anxiety attack through distraction such as licking their face or providing a paw. They can also help soothe and improve our mental well-being, and almost any animal can be used for this purpose. They have been found to lower blood pressure and reduce stress hormones, and can be trained to disrupt impulsive or self-harming behavior. Experts in animal-assisted therapy describe the relationships between dogs and children with autism or with severe anxiety as transformative and life-changing.